So this is a talk about interest, routines, obsessions and compulsions and repetitive behaviour in young people affected by autistic spectrum conditions. Thinking about what's going on and what we can do about it where these things become problematic. So we know that many young people affected by autistic spectrum conditions will have very intense interests. These interests may change over time. Typically in young children we see interests that last weeks, months or even years, or in some cases the interest may be lifelong. People may want to dedicate all their free time to this. An interest that we see a lot in young people is collecting, and this may be the sort of thing that their peers are interested in collecting, or sometimes we see young people who are very interested in collecting unusual things, for example bottle tops, sticks or pieces of litter. These interests are often very important to the young person, and interfering with this can cause distress and even challenging behaviour. What we observe and what we know from talking to young people with intense interests and obsessions is that these often help them to manage anxiety. Sometimes, in some cases, this is described as almost being thought blocking. So focusing on the intense interests can help to push away other upsetting and intrusive thoughts. As we said, the interests may or may not be typical for the young person's age. Sometimes these interests can be very positive. What we're seeing may represent the start of a career or a lifelong passion, and interests can often help support social networks when young people come together with other young people who share similar interests. A very common example for that being an interest in online gaming. Sometimes where interests are unusually intense and persistent, we might describe them as being an obsession. So here's a couple of accounts of people affected by autism, of their experience with interests. So the first person saying, we have the same love of things as everyone else, we just express it differently. And sometimes we rely on these interests more, especially if being popular in social groups is off the table. Losing an interest because of other people's perceptions would be simply another reminder of why we're not good enough. And besides, dinosaurs are bloody awesome. Let us love them. And Temple Grandin, a well-known writer, animal behaviourist and speaker. I would never talk just to be social. Talking with animal behaviourists or with someone who likes to sail, that's interesting. Information is interesting to me, but talking for the sake of talking, I find that quite boring. So why do we see these intense interests in young people affected by autistic spectrum conditions? I think it's one of those things that isn't really all that well understood yet, and of course it will be different for different people. Always, I think, in these type of talks we're thinking in terms of very broad generalisation, and individuals will all have their own reasons for why they present with these intense interests. Very generally, we can say that we think of people affected by autism as having a tendency towards slightly rigid or less flexible and black or white thinking. So typically in these young people we might find that things either interest them very strongly or they find them really dull. There can also be a tendency perhaps compared to their peers to focus on one thing rather than the bigger picture. Not just for people on the autistic spectrum, but I think for all people, our interests provide relief from a stressful world. Of course, these things can provide us with relaxation and fun, order, structure, predictability. They help us to make social connections. And for people, particularly people affected by conditions such as autism, intense interest can sometimes provide a sensory reward. So there may be aspects of the interest which are very visual. There may be a sensory element in touch, for example. Some young people are very interested in stroking and touching fabric. There may be an element of sound or smell which provides that sensory reward which they seek. So sometimes these intense interests seem to cause a bit of a problem, and sometimes young people even are referred to services with the intensity of the interest and the disruption that that's causing to behaviour or to daily functioning being the reason for referral. But clearly, most of the time, young people hold their interests and enjoy their interests without it becoming too much of a problem. So when is it a problem? This is actually sometimes a surprisingly difficult question to answer. Obviously, what some people view as a problem, other people may be able to tolerate. We do know that interests and obsessions are a recognised feature of autism, a part of the body of research around autism. They can be part of what we look for in diagnosis. So I think we come from a starting point that we may need to accept different expectations around young people's interests than we do for young people without neurodevelopmental conditions. So we may need to accept these stronger, more persistent interests and accept how important these are to the young person, and sometimes perhaps make more accommodation and be more flexible ourselves to allow them to engage in the interests that make them feel more happy and relaxed. However, there are certainly times when these interests can become problematic, and I think that's really around when they become too extreme and when they're disruptive to daily living. Sometimes these things can really be excluding of all other interests and experiences. For example, if a young person wants to do and talk about nothing else but their particular interest, and then that can cause a great deal of distress when they're interrupted, and can impact upon learning and the acquisition of new skills. Sometimes we know that unfortunately young people's passionate interest can lead to them becoming excluded socially, particularly perhaps they're talking about it excessively, missing the social cues, indicating that other young people are not so interested to hear about the interest. And perhaps it can sometimes make it difficult for them to engage in other people's interest, to allow them to have those sort of back and forth interactions with their peers where they're talking about their shared interest. It can be difficult if these interests are disruptive to school and family life. For example, perhaps the young person's collection begins to take over the house, or to make it difficult to keep the house in order, or where the interest makes it difficult for school staff to divert the young person onto other topics for their learning. In a few cases, young people have interests about things which could lead them into dangerous situations. You can imagine situations where the interests revolve around things such as electricity or train tracks, where that could be problematic. And in a few cases, although it's very rare, the interest can lead to socially unacceptable or destructive behaviour, and that can occur where the young person is so passionately fascinated by a particular thing that perhaps they'll do whatever it takes to get access to the thing that they're interested in, and that can certainly in a few cases lead to behaviour which society can't allow to happen because it's disruptive or could put the young person or others at risk of harm. But that's certainly very, very rare. I tend to think of us all as having a spectrum of interests which range from what's seen as typical, normal interests which society expects and accepts us to have, such as somebody might have an interest in watching the football, or knitting, or keeping pets, or baking. Sometimes our everyday interests develop into passionate hobbies which might take up more of our time, our energy, and our finances. But still, in most cases, society sees that as being pretty acceptable and okay. And then at what might be seen as the extreme end of this spectrum, we have very fixed obsessive interests, perhaps leading into behaviour which is seen as more problematic or less acceptable. And I would argue that we all tend to move up and down this line at different times in our life, and that can be in response sometimes to stress or life circumstances. Lots of people will tend to become more engaged and preoccupied by their particular interests at times of stress as a coping mechanism. People affected by autistic spectrum conditions may on average tend to be operating at a slightly different point on the line on average, so perhaps we could think of them as on average tending to be more towards the end of having passionate hobbies or fixed obsessive interests. But certainly people with autism can have mild, manageable, what society might view as completely normal and acceptable interests. And certainly people without a diagnosis of a neurodevelopmental condition can also have obsessive interests, and we may even have some of those ourselves or have family members who have what we might regard as obsessive interests. It's interesting to think about what society considers acceptable and unacceptable interests, and I think sometimes things which are fascinating to one person but which might seem odd or unusual to other people, even though there's no implication of any harm to anybody, can cause concern. So for example, where young people are very interested in something like, for example, a particular insect or a particular machine or a particular component of a machine, sometimes that's seen as being problematic, perhaps sometimes just because it's unusual. It may not actually be causing anybody any harm. It may be something that brings a great deal of pleasure to that young person. So I would argue that we perhaps need to be careful about pathologising these things too much or seeing them as too problematic in some cases. So where interests do become problematic, what should we do about it? In general, we're not often aiming to completely remove the young person's interest, but more to get it within reasonable limits and to help manage any anxiety or distress which may go with the interest. Sometimes a young person engaging very intensely in a particular interest might reflect that they've got some underlying anxiety which they need support with. I think we need to remember that adjusting a young person's preferred activities can actually be very tough for them and their families, and I think we can probably relate to that if we consider how we would feel if someone was to interfere with our own favourite hobbies. For example, if you were to tell an avid football fan that they weren't allowed to watch football anymore, they probably wouldn't be too happy about that. So thinking about minimising the stress associated with trying to intervene with someone's particular interests. We know that obsessions and strong interests tend to get worse if a young person is anxious, so it's probably important to make their life as predictable and safe as possible, to encourage communication skills, to reduce any frustration, to manage any sensory issues that may be going on, for example reducing any overload of overcrowding, too much noise, bright lights that they may be encountering in environments such as school. And also, of course, we need to address any underlying problems which might be causing anxiety, such as bullying, being stressed around schoolwork, and anything else that you might be aware of. So So thinking about some specific strategies to help support the young person with managing their particular interest. We might think about setting limits. The example given here is maybe you can talk about SpongeBob for a certain number of minutes 3 times a day. We can use visual supports. Sound timers can often be helpful because it's really visual. It doesn't depend on the young person being able to read a clock. Charts can be helpful. A prompt which lets the young person know that, okay, now it's your time to talk about your particular interest. That might be a card, in this case with a picture of SpongeBob on it, which we put on the table to help prompt us that now is the time for our SpongeBob chat. Sometimes setting physical limits on things, so where you've got a young person, for example, with a massive collection of toy cars and they want to take them all to the shop, perhaps you could find a small manageable box where they can choose their favourite toys to take to the shop. Social rules provide limits for all of us in everyday life, but for young people affected by autism, of course, it can be more difficult for them to pick up on those social rules, and even where they do know those social rules, for example, a young person might know that we shouldn't talk about our particular interest without giving the other person a chance to talk. The interest can be so strong that it overrides these rules, even for children who get them. So sometimes giving very clear instructions. For example, a young person who had an interest in stroking fabric or people's skin might need to be taught you can't touch people you don't know. So it's making the instructions very clear, really black and white, and often with these sort of prompts we need to teach them early, so to start at a young age, and to teach often, so probably repeating it more often than you might have to do for a young person without a neurodevelopmental condition, and often to repeat these things over and over again until they're really well learned. Provide rewards to encourage the young person for following those rules, and using prompts such as social stories, cartooning and visual supports to help reinforce the social rules that you're trying to teach. I think rewards can be helpful, and I think again we need to remember this is a really hard thing that we're asking the young person to do. And what would it take if somebody was to ask you to give up your favourite hobby or interest? And so really trying to make the reward tailored to the child's interest, and to reward them sometimes for very small steps, so it might be that the young person who's got a particular interest and wants to take loads of cars to the shop deserves a reward for managing to take a smaller box of toy cars to the shop. Do expect some resistance where you're trying to perhaps set some new limits around a particular interest. Explain as far as possible within your child's understanding. Older children may actually be able to recognise the difficulties themselves and help come up with a plan, and children often surprise me with the degree of insight they do have when you really give them a chance to think things through, and with the amazing solutions that they're able to come up with for all these sort of problems. And getting children involved in problem solving can be really helpful. So for example, if a child has a massive collection, say, of sticks or stones that's taken over their bedroom, maybe they could be involved in choosing some containers to store these things in, which might help motivate them to help keep the collection within slightly more manageable limits. So we've got some more ideas to try. Can we use the special interest to motivate the young person? The example given is if you do 5 minutes of your homework, then you can have 5 minutes of playing with your trains. Often these things will be a better motivator than anything else we can think of. For older children, a typical one might be after you've done your homework, then you can have some Xbox time. For a young person who's interested in fairies, you might say, let's have a go at tidying your room, pretending to be fairies, making a tidy up spell. In situations where a child's talking constantly about the interest is becoming problematic, it can sometimes be helpful to try to provide a minimal response to comments about the special interest when it's not related to what's happening right now. So for example, say you're helping the child with their schoolwork, or you're trying to engage them in another activity that you set up for them. You might just briefly say, okay, we aren't talking about trains right now. Perhaps try to distract them onto the topic at hand. And alongside that, to give loads of positive attention when the child comments on something that is relevant to what is happening. So really praise them for connecting with the activity that you're trying to engage them with, for connecting with what's going on in the world around them. You know, explicitly praising, for example, saying you were really good at spotting what's going on. Give plenty of opportunity to talk about the special interest still at other times. So as we said earlier, this isn't about cancelling out a child's passionate interest, which is so important to them. In most cases, that's the last thing that we want to do. But perhaps it's sometimes about redirecting them and coaching them about when it's a good time to talk about their interest, giving them the experience that sometimes it's not the right time to talk about this thing and we need to talk about something else, but when it is the right time to talk about the special interest, we're really there, we're really engaged, and we really do want to hear about it. And then give them plenty of praise or positive attention, however is acceptable to that young person, for getting it right. And a few more ideas about what we can do when we need to intervene a little with a young person's interests or obsessions. Sometimes it's possible to gradually expand and diversify. So if a young person likes one story with a dog in it, maybe finding other books with dogs in, or books with similar looking dogs in. If they like pushing buttons to make a sound, experimenting with different toys or keyboards. Where you can, maybe getting the young person involved in making choices. Perhaps they can search the internet with you for toys they might like. Perhaps they might go with you to the shops to choose. Obviously, this stuff isn't always easy. It won't always work, and it could get expensive. I'm sure we've all parents, teachers, and people who work with young people have had the experience of buying and providing toys and resources which just don't hit the spot and the young person just isn't interested. So things like toy and book libraries, car boot sales, charity shops, swapping with other families can be helpful. Another suggestion that I have, which can often be really helpful, is to get alongside the young person in their interest. So perhaps the time you spend together includes a little bit of what they want to do and a little bit of what you want to do. So show some interest in their passion while you're helping extend this a little bit. So perhaps sitting with them, painful though it might sometimes be, to watch an episode of SpongeBob, and then you'll help them make a painting of SpongeBob for a few minutes afterwards. Going to the railway station with them, watching the trains with them for 10 minutes, and then going and having a drink in the cafe while perhaps they do some drawing, then going and watch the trains for another 10 minutes. So it's just starting to introduce the idea of a little bit of compromise and a little bit of their time and a little bit of your time. If you have a young person who's into collecting, maybe you could start your own collection of something and talk to them about collecting, maybe create displays alongside each other, reflecting your own collections. Lots of us actually already have collections, although we might not think of them as such. So lots of us who are into craft activities might have a collection of craft materials. People who are into knitting might have hundreds of balls of wool. People who are into gardening actually have a collection of plants. So we don't always think of these things as collections, but actually they are collections, and your own interests in collecting might be a point of connection between you and the young person. You might be able to help them search the internet and make a project about their interest. For example, let them do a talk for you about their interests. One thing that I always find quite successful, but also quite challenging with my own family who are interested in gaming is just to get them to show me how to play one of their games for a short time. So for example, I might say, okay, I've got 20 minutes, can you teach me how to do a bit of Minecraft or Fortnite or whatever it is? As grown-ups, we don't on average tend to be as good at this as young people, so it's a really good chance for them to feel in charge and that they're teaching us something, which can really help develop communication and boost a young person's self-esteem. And actually even older teenagers can often really appreciate feeling that the adults in their life are prepared to try and enter their worlds and share their interests a little bit. Okay, so this is a clip from a young man on YouTube who's talking about his own interests and obsessions. If you want to watch that, you can cut and paste that link, I believe, but I'm not quite sure how to get it to work from this talk, so I'm going to have to leave that one with you, I'm afraid. Another aspect of repetitive behaviour is something slightly different, sometimes called stimming or self-stimulatory or stereotyped behaviour. And these are the behaviours that we see more often in young people on the autistic spectrum than in their neurotypical peers, including things like hand flapping, finger flicking, rocking, making repetitive noises, sometimes repeating phrases that they've heard, but in a way that's out of context. Sometimes this can include head banging, flicking objects, spinning wheels, and so on. Although this can sometimes appear unusual, where it's more extreme or more frequent, this is actually a form of something that we all do. When you think about it, all people and all mammals actually at some point will display repetitive physical behaviours. Common ones that even adults do is hair twiddling, toe tapping, and nail biting. These behaviours often start very early in childhood, so it's really quite normal for young children and toddlers to rock back and forth, to twiddle their hair, to chew things. It tends to reduce on average as we move through childhood and into adolescence, and as adults, even if we may have a tendency to do these sort of things, what we've really learned to do is to suppress the urge and not to do it in situations where it's not socially acceptable. But I bet that a lot of us are more likely to chew our nails, tap our toes, fidget when we're in a situation without other people around, or without other people around who we feel may judge us negatively. So this stimming that we talk about in young people affected by autistic spectrum conditions is really an extreme form of something that all people do. And you can see here a description, a first person account of self-stimulatory behaviour, and this person explains it's literally just a physical expression of trying to cope. Some only do it when it gets too much, others will stim to try and deflect a meltdown, like me. I find stimming calms me and helps me divert from an issue, and my parents picked it up as a warning sign that whatever was bothering me needed to either stop or be explained. And so some of the reasons for this repetitive behaviour might include helping manage strong emotions, as the person you've just heard from explained. Sometimes these behaviours can also serve to increase sensory input. So rocking may stimulate the balance system, hand flapping in front of the eyes may provide visual input, tapping or stroking may provide tactile input. These behaviours can also sometimes serve to reduce sensory input. So if someone's feeling overwhelmed by sound, humming may help them to block out other sounds. If someone's feeling visually overwhelmed, focusing on a spinning object can help focus on that and exclude other visual inputs which they may be finding confusing or disturbing. So these things can help deal with stress and anxiety by regulating the physical system. And again, we all tend to do this, you know. If any of us are feeling anxious, distressed, stressed, tired, you may notice that you're doing things like tapping your fingers, tapping your feet, chewing your nails. And these are all clever ways, subconsciously, that we behave to help our body manage stress and anxiety, and to regulate the level of arousal within our physical system. Self-stimulatory behaviour can also help increase predictability, and predictability is something that we know lots of people affected by neurodevelopmental conditions find pleasurable. So seeing an object always spin or move in the same way can be quite enjoyable, and these things can help pass the time. These behaviours can sometimes reduce feel-good chemicals in the body. As we said, they're likely to increase under stress or excitement. I think we also need to bear in mind that young people affected by autistic spectrum conditions may not be as aware of or as concerned by other people's reactions or judgments to these behaviours as adults, or by their typically developing peers. So one thing which for many of us inhibits us doing these things in public is that we worry what other people might think of us. So somebody might find it comforting, say, to hum or whistle a particular tune, but by the time we reach adulthood, most of us have learned that it's not okay to do that, for example, in a work meeting. So we put a lid on those behaviours and we manage not to do them. But for people who are less socially attuned, they may not always reach that point, or they may need quite explicit coaching, that, you know, we don't whistle, click or thump the table, for example, in a classroom setting, because that's distracting to other people. So they might just need very clear, repeated explanations about the impact that this behaviour has on others, or it may be that they just don't get it, you know, they just don't understand that other people are being disrupted by this, and they're certainly not doing this maliciously or to be disruptive or naughty in any way. In some cases, people may genuinely be unable to control these behaviours, or they may have only very limited control. They may only be able to exert control over these behaviours in situations of low stress, and when they're under higher stress, their need to present with repetitive behaviour to manage that stress may be overwhelming, and they may genuinely be unable to control these behaviours. In which case, putting pressure on them to manage the behaviour is only going to increase that distress, and it's going to be potentially unhelpful. So thinking about when these behaviours, sometimes described as stimming, become a problem. As we said when we were talking about interests and obsessions, that thinking about when it actually is a problem is a tricky question. And although some of these behaviours may appear odd or may make other people uncomfortable, it can be very important to bear in mind that for some people these are vital coping strategies. And you heard the person earlier on explaining that actually for them, their repetitive behaviours would sometimes help avoid their distress escalating to the point that they entered a meltdown. But obviously there may be situations where these behaviours are extreme or dangerous, where they exclude other behaviour and prevent interaction with others. There may be cases where they cause harm to the child, for example, where they're banging their head or biting themselves, where they cause destruction to property, or in some cases where the behaviour is harmful or frightening to other people, where we do need to try to intervene to help the young person to manage situations differently. So what can we do about these types of behaviours? In these situations, I was always aimed to try to understand the function of the behaviour. What is the young person getting out of this? And as we saw in the few previous slides, these behaviours can serve many different functions. It may be about regulating sensory overload, it may be about preventing distress escalating, it may be that the repetitive behaviour feels nice, it feels soothing, but for the individual young person, it's really important to try to understand exactly what this means to them. Now, these type of behaviours can be very difficult to change, but options may include changing the environment. So, for example, if a behaviour seems to be driven by a need to regulate sensory overload, can we reduce the sensory input? For example, it might be that a child needs to be in a smaller, quieter class. It might be that they need to wear noise-blocking headphones. It might be that they need to wear sunglasses if the classroom is too bright. And I can remember working with a young person in a school environment who was presenting with concerning repetitive behaviours, including headbanging, biting themselves, and actually what was causing their distress was the sensory input, that things were too loud, they were too noisy. Their school was able to move their teaching group to actually a different classroom, a different part of the school, where there were fewer people coming in and out, and that actually made all the difference, and that was all that we needed to do in that case to help reduce the the harmful behaviour that they were presenting with, which actually was serving an important function for them, which for them was helping them to cope in an environment which otherwise was intolerable for them. So what needed to happen, rather than focusing on telling the child to stop their behaviour, was to change the environment. Sometimes we might be able to find other ways of helping a young person get equivalent sensory input. So, for example, if a person's chewing their clothes excessively, perhaps we could provide them with some jewellery or an appropriate chew toy instead. If a person's pacing up and down in a way that's not appropriate for the environment, perhaps they could be accompanied to go for a walk around outside, which might help them to calm down. Can we sometimes substitute an alternative, such as supporting a young person to squeeze a ball, for example, rather than to flap their hands or hit the table? Always thinking, is this behaviour problematic? Is this something that we need to do anything about? Is this something about our discomfort with the behaviour, which actually might be quite appropriate and helpful for a young person, rather than it being something that's problematic? So again, always starting with that question, is this a problem and who is this a problem for? Whilst recognising that certainly in some cases these behaviours can cause a problem. Sometimes young people might be able to limit the behaviour to certain environments or certain times. So for example, we might coach a young person that perhaps if it's a vocalisation that they're making, that there's a part of the school or a part of the house that they can go to where they can do that when they need to, rather than doing that in the class environment where it might be difficult for other people. Some people certainly feel a need to let off excess energy, and you'll know, from young people that you've known and from young people in your family. I describe some young people as being physical copers, so they need, to wave their arms and legs around, or they need to shout, or they need to jump, or they need to run around, and that's just how they cope. And particularly for those young people who are who need that physicality to help them cope. Things like jumping on a trampoline, running around, jumping up and down can be really helpful. So scheduling those things in, not just in terms of having, an exercise session a few times a week, but during the school day, can they have a break for physical activity regularly when they need that? Another thing that some parents have described being really helpful is actually joining in with the child's behaviour, so if you have in your family or you're working with perhaps a young person who rocks or spins or likes to look at spinning objects, similarly as when we spoke earlier about getting alongside a child with their special interests, sometimes we can get alongside them with this type of behaviour, and perhaps on some level, even for young people who are non-verbal, that might just help be a point of connection. It might help you understand what they're getting out of the behaviour. For example, a lot of people find rocking backwards and forwards soothing. It's something that we don't tend to do as adults, but perhaps, when you've got a quiet moment over the next few days, you might be prepared to give that one a go. And perhaps sitting down next to a young person, for example, who's looking at wheels, spinning wheels, or tearing up paper, or whatever it is, and just joining in that activity with them for a short time shows that you're interested, you're trying to enter their world a little, and it might also help you relate and understand what they're getting out of that activity. So those are a few suggestions for things that we can do, always emphasising though that it's all about the function of the behaviour for the individual and understanding what's going on for the individual child, and that these behaviours may sometimes be serving a very important purpose. So we don't just want to dismiss them as being pathological or maladaptive in some way without trying to understand what's going on for the young person. So very briefly, just to mention obsessive compulsive disorder, because I think these things, our normal interests, our habits, and particularly our strong interests, can sometimes described as being a bit OCD, or people might say, oh, I think you've got a bit of obsessive compulsive disorder. But actually, obsessive compulsive disorder is a very specific thing, and it's very different from either everyday interests, also from the repetitive stereotype behaviours that we were talking about earlier. So I just thought it was worth mentioning to try to unpick that a bit, although this is going to be a very brief overview of a potentially massive area, so excuse me rushing you through it. So obsessive compulsive disorder is a type of anxiety disorder which often starts in late childhood or during adolescence. A person experiencing this will suffer from recurrent upsetting thoughts, obsessions, and these thoughts often make them feel like they have to do something, like washing or checking or hoarding. So classically, a person might have an upsetting thought about disease or illness which drives them to wash their hands repetitively. This makes them feel better, but only for a short while. The thought returns and the cycle starts again, and so they find they're washing their hands again and again. When this is severe and interfering with a person's daily life, they often need intervention, which might include talking therapy or in some cases medication. I think there's a really important difference between the obsessive interests in OCD and the obsessive interests which we see in young people affected by autistic spectrum conditions, and that is that for these young people affected by autistic spectrum conditions, the interests are not troubling. They actually want to be thinking about the thing they're interested in. So they would want to be thinking, for example, about Lego or cars or water or whatever it is. That's very different to somebody affected by obsessive compulsive disorder who will find their intrusive thoughts troubling and want to get rid of those. Similarly, the behaviour in the interest of someone affected by autism is not driven by a troubling thought. They want to be doing the thing they're interested in. It rewards them or it comforts them. However, we do know that OCD, as well as all other anxiety disorders, does crop up more commonly in people affected by autism. And certainly people can have passionate or obsessive interests and repetitive behaviour, and they can also have OCD all at the same time. Obviously this can get complicated, it can be difficult to tell these things apart, even for the person affected or for the supposed experts on these things. And even in people affected by autism who don't have obsessive compulsive disorder, they may, particularly at times of stress, show what looks like an increase in repetitive behaviour related to their routines and interests. So it may look like they have OCD, even though it may not actually be the case that it's an underlying troubling thought driving the behaviour, as would be the case in classical OCD. If ever you have any concerns along these sort of lines, if you're wondering if your young person might be starting to display traits of obsessive compulsive disorder, I'd suggest discussing those with a professional, possibly starting with your GP or even somebody at your child's school who'll be able to refer you on to the right services to help with that. And just to finish with, there's some further reading suggested for you here, which I hope you'll find helpful, and I hope that you have enjoyed this talk. Congratulations on persevering to the end.